If you've had back pain, you've probably heard that anterior pelvic tilt is a cause. And if this is the case, you've probably tried exercises to fix anterior pelvic tilt in order to reduce your back pain. But in many cases, these approaches not only fail, but can also contribute to making the problem worse. Now, I know this sounds crazy, but in many cases, people misdiagnose themselves as having too much anterior pelvic tilt when in fact they don't have enough. So in this video, we're going to talk about what contributes to this misdiagnosis of anterior pelvic tilt, talk about in what context you might need to improve anterior pelvic tilt, and give you some of my favorite introductory exercises that you can use step by step to improve how you move and alleviate your back pain. So, without further ado, let's go ahead and jump right in. Alright, so if you've watched these videos that talk about anterior pelvic tilt, they've probably helped you to identify anterior pelvic tilt in one or both of these two ways. The first is going to be looking at your posture from the side view. So if you have a forward inclination of the pelvis where the back is higher than the front, they're going to tell you that you have anterior pelvic tilt just based on looking at it. Now, the second way they'll tell you to identify anterior pelvic tilt is by looking at movement. And this is where a lot of people get confused. You'll hear people say that rib flare and extension of the back couples with anterior pelvic tilt. And while this is true in some cases, this creates a lot of confusion because it's not always true. If we look at what anterior pelvic tilt really means, it's movement of the pelvis forward on top of the legs. And while from a postural perspective, that might look like this, during movement, we're actually going to see that happening a lot in normal contexts. And even more importantly, in many of those contexts, we are not going to see flaring of the ribs or extension of the back. And in fact, in many contexts, when we see flaring of the ribs or extension of the back, it actually correlates to a decreased ability to anterior tilt. Now, what does this have to do with back pain? Many times when people fail to be able to anterior pelvic tilt in the context of movement, what you'll see is that they'll lead by thrusting their rib cage forward. As they thrust their rib cage forward to get down to the bottom of a hinge or a squat, oftentimes the lower part of the spine and the pelvis lags behind and fails to move into anterior tilt. As this happens, we have the bones above moving into extension relative to the bones below lagging behind in flexion. This means that the bones up top move forward as the bones down below stay back. The problem with this is that when two bones move in opposite directions, it creates shear forces. And when we add a load to this, we only increase those shear forces further. In the case of back pain, you likely are already sensitive to mechanical loading of the spine. And shear forces tend to be poorly tolerated in general, but especially when you're already dealing with lower back pain. So in many cases, increasing access to anterior pelvic tilt decreases the need to thrust forward at the rib cage and upper lumbar spine. The net effect of this is that the bones all move together in the same direction and we reduce those shear forces. Less shear forces means less chance that we're going to sensitize an already sensitized area. Okay, and the last little note here before we get into the exercises is answering the question, but what if I have anterior pelvic tilt as a posture? Well, it turns out that the posture we're in does not always correlate very well to our actual capabilities in the context of movements. We said that in many cases, we're flaring the ribs and arching from the back to pull the pelvis along for the ride. This is creating the illusion of anterior pelvic tilt, but then we see a decrease in dynamic capabilities in the context of movement. So in this case, we have a rib cage and spine that's moving forward, and then a pelvis that is unable to move as well as we would like. So to be able to fix this, we need to reverse this relationship. We need to learn how to keep the rib cage back over the pelvis and then move through the hips, anteriorly tilting the pelvis on top of the legs. All right, let's jump into the actual exercises. All right, so exercise number 1 here is going to involve getting onto hands and knees to work on the relationship of the rib cage and the pelvis. This aligned relationship of the head, rib cage, and pelvis is what we commonly refer to as the stacked position. The way that we lose the stacked position when we're experiencing too little anterior pelvic tilt is once again too much forward rib cage motion and flaring at the lower ribs, but not enough extension in the very lowest part of the back and a decreased ability to move the pelvis on top of the legs. So, to get into this position and reverse engineer this, we're first going to push through the hands to move the rib cage back away from the support surface. Once we move that back away from the support surface, we're going to maintain that pressure in the hands to keep the rib cage nice and still throughout. From this position, we're then going to initiate an anterior pelvic tilt. I'm going to give you a couple of cues here that you can play with and see which one works best for you. The first one that we're going to use is to simply think about pulling the front side of the pelvis down as we reach the upper part of the pelvis back. I don't mean to be crass here, but one of the ways to think about this is almost like facing your butthole toward the ceiling. Now try that cue a little bit, pulling the front of the pelvis down and sticking your butt up in the air while maintaining the rib cage in a static position. As you're doing this, pay attention to movement in the rib cage. There should be very little movement in the rib cage, and if you're tending to try to arch forward with the lower part of your rib cage, try not to do that. Practicing this, moving the pelvis into anterior tilt as you keep the rib cage static, is going to teach you to disassociate motion of the lower ribs and the pelvis. This is going to reinforce more of a neutral spine position where we have a normal amount of rounding or kyphosis in the thoracic spine and a normal amount of arching or lordosis in the lumbar spine. Now, as we get used to this, we can also sync this up with the breathing. So as we go into anterior tilt, we can take a nice deep breath in. And then as we go back to that initial point, we can exhale. And this will help you get used to moving the pelvis relative to a rib cage that stays nice and still, as well as integrating some of the abdominals and diaphragm. Now, if that initial cue didn't work for you, and you feel the front of your hips getting a little bit tight, there's a couple of things that you can try. First of all, move your knees slightly out to the side or bring your feet closer together. As you do this, use the same cues as before and see if it's easier to move your pelvis. You might have to go slightly wider, but not too wide to find the best possible hip position to allow that movement. Now, another cue that I also use, if just thinking about the front of the pelvis didn't work, is thinking about your pubic bone. So the bone right in front where your genitals are, you're going to think about pulling that downward and backward between your upper legs. Oftentimes, this helps us to reduce tightness in those inner thigh muscles that can often contribute to that tight feeling. Now, once you find the right stance and the right cue, once again, practice moving that pelvis into an anterior tilt and back to that initial starting position without moving the rib cage. Now, once we have this down, we're ready to integrate movement at the hips with a better stacked position. All right, so for exercise number 2, we're gonna start with the position that we achieved from exercise number 1. We're going to start in hands and knees, push back by using the hands to get the rib cage over the pelvis. Then we're going to move into anterior tilt without losing that rib cage position. And from here, we're going to start to incorporate movement through the hips. With the hands still moving the rib cage back, we're now going to apply an upward force against the table. That upward force is going to push us back. As we're doing this, we're going to try our best to maintain the same exact shape between the pelvis and the rib cage and the spine, while getting the majority of the movement to happen through the hips. As we do this, we're going to notice when we lose that anterior pelvic tilt and start to feel the butt tuck under and the low back round. We're going to stop the motion just before that happens, return back to the start, and then repeat. Now, a few additional cues that can help you to avoid that rounding or at least delay it a little bit longer are to either actively pull yourself down into your hips by thinking about using your hip flexor muscles, or think about tightening the very lowest muscles in your back to keep an arch shape. You might elect to do both of these at the same time, once again playing around with the width of your stance and your feet until you find the perfect hip position for your anatomy and the best cues for you. Now, once you have all this together, the right stance, the stacked position, and moving mainly through the hips, then we can start to integrate the breathing, taking a nice breath in as you push back, and then exhaling to return to the start. Push back, inhale, and then exhale, return to the start. So exercise number 3 is now going to take us into an upright context and help build out those skills that we learned in exercises number 1 and 2. We're going to start by setting up with the back against the wall and the feet about 7 to 10 inches away. From this position, we're going to work on creating the shape that we did in exercises number 1 and number 2. The first step is going to be to simply draw the rib cage back into the wall, especially at the lower rib cage level. As you do this, you'll probably feel your back flatten against the wall, and usually the pelvis will tuck under as you do this. From this position, we're going to maintain the lower ribs against the wall, but we're going to use our cues to move the pelvis into an anterior tilt. The way that you'll know that you're getting this is you'll still have pressure in the lower part of the rib cage, but pressure in the lumbar spine will start to decrease. You should be able to put a hand below your lumbar spine and be able to get at least a little bit of your fingers into that space. Once we have this relationship of ribs back and a little bit of an anterior tilt, we're then going to take this existing shape between the rib cage, spine, and pelvis and learn to move primarily through the hips. This is the skill of hip hinging that is going to allow you to avoid those shear forces. To do the actual hinge, we're going to soften the knees a little bit. And then you're going to think about just moving the back of your butt up the wall as high as you can. And as you do this, you might feel a little bit of stretch in the hamstrings or the glute muscles. It's going to be totally normal. And a tendency at some point to feel like you get a little bit congested in your hips and have trouble moving further without rounding your lower back. If this seems like it's happening really early, go back to those cues that we worked on in exercises number 1 and number 2, and also look at adjusting your stance. Once you find the best cues and the stance that works for you, you should be able to move more comfortably through your hips for longer before losing that shape. All right, so once you have this down, now we're ready to move into the most challenging exercise of the day, which is going to come away from the wall and take all of this and integrate it together into a common gym movement. Okay, so exercise number 4 is a good old-fashioned hip hinge. We're going to be doing this with a kettlebell in this video, but you can do this without weight, or you can even use a barbell. To set up in this position, if you're using a weight, you're going to hold it below you. Then you're going to shift back through your rib cage. Now anterior tilt your pelvis without flaring your ribs. And if you can get this down, which you should be able to because of exercises number 1, 2, and 3, now all you have to do is practice moving primarily through the hips. So with relatively balanced pressure in your feet, you're going to sit your hips back with a very slight bend in the knee. As you do this, you want the pressure in your feet to stay exactly the same the whole time. As you're doing this, the shape between your rib cage, spine, and pelvis is going to stay the same as all that motion happens through the hips. Now, in this context, we likely don't have to use the cue of pulling down as much through the hip flexors because the weight is going to help to pull us down. And all we really need to think about is relaxing those upper hamstrings, glutes, and the back of the pelvis. If we need to, we can initiate the motion by pulling down with the hip flexors in the front and then letting the weight do the rest of the work. Now, one thing to watch out for here is as you do this, you don't want that weight to pull your rib cage forward and into a flared position, especially if it means leaving your pelvis and lumbar spine behind. Remember, it's this forward rib cage, but pelvis that can't keep up that creates those shear forces and increases the probability of lower back pain. All right, so now that we're through the exercises, you're probably wondering how many reps and sets of each should you do? Now, unfortunately, I cannot give you a concrete answer here. And the reason is that these exercises build skills, and some people will be able to get through and build those skills much faster than others. Now, if you do want a step-by-step program, I bring you through not only this skill, but all the other foundational movement skills that you need to move and feel your best inside of my Movement Foundations programs. So if you're trying to improve lower body movement and you want to take all the guesswork out of it, go down to the link in description and pick that up. As always, questions, comments, likes, and all the rest of the things that help the algorithm to help me help more people, make sure you do them. And until next time, peace.